This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. This is Professor Michael Chapman, one of the most experienced IVF specialists in Australia, working in infertility for 35 plus years. Thousands of patients, thousands of babies, in fact, as a result of the care that I've provided. Tonight I thought we'd start by talking about personalised medicine. What does that mean? It means tailoring a particular treatment to a particular person's needs. The difficult bit is defining what the needs of that individual are, and that comes, number one, by experience and proper training. Around Australia, there are many doctors, specialists, gynecologists who dabble in IVF, and while they work in clinics that claim personalised care, basically they're working to a recipe for the general public, not for you as an individual. So personalised care requires an expert to be deciding what dose of drug for how long, what type of therapy is best. And that's what personalised means. So, for instance, in our own clinic, Life Fertility Sydney, we have 5 specialists who've all done extensive training in the area of infertility and also are very experienced. They've all had at least a decade of experience treating patients with infertility. So when a patient comes to us, we sit down with the patient and we start with a detailed history. And there may be aspects of the history that make you different to anybody else. And therefore, we will adapt therapy and adapt the treatment to fit with your background. The next step after that is to do the appropriate investigations, because that's what leads to the final decision making in what sort of therapy we should be undertaking. And as I said before, the dose of drug for how long and what type of treatment is going to be best for you. So the first step in that is going to be some blood tests, looking at your ovarian reserve, looking at your pituitary hormones, looking at your thyroid function, making sure that you're fit and healthy as much as possible. Based upon those results and a detailed ultrasound, because we want to know that your ovaries are in the right place, that you're not suffering from other conditions like endometriosis. We want to exclude that before we move forward to treatment. And it may be on an individualized basis, surgery may be the next step if you have significant endometriosis, because it certainly reduces the chances of conception, either naturally or through IVF. Then we'll sit down with you and go through all those results, and in determining what the next step is, we'll be taking all of those results into account, your wishes, which again is part of that personalisation. There are some patients, for instance, who go through IVF who don't want to create more than 1 or 2 embryos because they don't want to have excess at the end of the day. There are patients who don't want to start IVF unless they really have to, and there are a series of steps before that, including induction of ovulation, of the use of intrauterine insemination before we need to move on to IVF. In fact, probably as many patients that I get pregnant with IVF actually get pregnant without needing to have IVF. And that's real personalised treatment. It's not rushing people into an IVF cycle. It's not necessary for everybody. So that concept of personalised medicine requires an expert to start with, doing the right tests, the right time, and providing the right advice to you as an individual. We pride ourselves on doing that. That's what I've done all my career. At Life Fertility, all our specialists have that aim in mind.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.